Hello, I'm Lisa P. Jackson, Administrator of the U.S. Environmental Protection Agency. I'm proud to be marking this year's Public Health Week with the many individuals and organizations who tackle these issues with us every day. 40 years ago, the EPA was created with a mission to protect the health of the American people. It's our job to safeguard the air we breathe, the water that flows into our communities, and the land where we build homes, schools, businesses, and churches. Those are things the American people expect and deserve, whether it's the everyday protection of air and water or a response to situations like the Japan nuclear incident, where EPA monitoring of radiation levels is keeping all of us aware and ready to act in the event of any potential public health concerns. The environmental standards that EPA enforces today keep 1.7 million tons of pollution out of our skies each year, ensure that more than 90% of Americans have access to clean, healthy water, and sustain the thousands of cleanup efforts taking place in communities across the country. What those statistics really mean is that the buses that take our kids to school in the morning no longer spew dangerous lead emissions into the air. When you pour yourself a glass of water, you can be confident it will be free of harmful chemicals. And when you buy an apple at the store, it hasn't been sprayed with arsenic-based pesticides like they were decades ago. These are all part of EPA's work to protect our health and the health of our children. A cornerstone of that work is the Clean Air Act. This law is literally a lifesaver, and for years has helped reduce asthma attacks, heart disease, and other health conditions that burden American children and families. In 2010 alone, the Clean Air Act prevented 160,000 premature deaths and 170,000 trips to the hospital. This year, Public Health Week follows the announcement of an important update EPA is making to our Clean Air Act protections. EPA recently proposed the first ever national mercury and air toxic standards for power plants. Under the Clean Air Act, these standards will require American power plants to utilize pollution control technologies to cut harmful emissions of mercury, arsenic, chromium, nickel, and acid gases. These pollutants are linked to neurological problems, developmental disorders in our children, respiratory illnesses, and other debilitating and costly health challenges. The widespread use of modern pollution control technology would prevent an estimated 17,000 premature deaths and 11,000 heart attacks, while also preventing 120,000 cases of childhood asthma symptoms and ensuring 11,000 fewer cases of acute bronchitis among children each year. We are initiating an effort that, through the common sense goal of reducing harmful pollution in the air we breathe, will save thousands of lives and prevent hundreds of thousands of illnesses. It's an important reminder of the critical role the EPA plays in safeguarding our health and our children's health, and just one of the many reasons why we're proud to be a part of marking this year's Public Health Week. Thank you very much.